This episode is brought to you by Young Innovations. Are you ready to transform your career as a dental hygienist? Join us for an eye-opening webinar that I am providing in partnership with Young Innovations on December 3rd at 7 p.m. Eastern Standard Time about redefining the role of the dental hygienist, unleashing leadership potential and advancing your career. This is your chance to discover untapped opportunities and take your profession to new heights. Whether you are looking to step into new leadership roles, expand your clinical expertise, or explore new paths in hygiene, this webinar is designed to help you thrive. Don't miss this opportunity to invest in your future. Register now on the Young Dental website at youngdental.com under education. Thanks, Young, for supporting our show and championing dental hygienist professional growth. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner. Today, I have with me Katie Benavides, who is an entrepreneur and such an inspiration, Katie, to those folks who are saying, okay, what else is there in dentistry? How else do I support what I am doing every day with technology? How do I help my patients? So thank you so much for being on.
Oh, you're so welcome, Kelly. I'm so excited to be here and chit chat with you.
I know. So you guys, so Katie's the hygienist. She's going to tell you all about that. But she's doing amazing things with technology that has been out for a long time, that has been out since probably I started practicing, right? Katie, how long has it been?
Yes, at least 20 years.
Yeah, at least 20 years. So yeah, okay. Maybe it was right around the same time. So Katie, first, I always ask the question of why hygiene? Did it choose you? Did you choose it?
Oh, so I chose it. From a young age in the dental office, when I'd go and get my teeth cleaned, I would watch them clean my teeth above in the headlight. And I was always so intrigued at them scaling at my little baby teeth at that point. And so I just continued to grow that passion. And I feel like as kids, everybody's always like, what do you want to be when you grow up? What do you want to be when you grow up? And you feel like pressure to have to choose. And so I did choose at a young age. I remember telling everybody all the time, I'm going to be a dentist or a dental hygienist, something in dentistry. And I had an aunt that was like, ew, why would you want to do that? That's so nasty. And I was just like, oh, that just empowers me even more. The nastier, the better, I guess.
Until you actually got that in your chair and you're like, what did I sign up for? No, we actually love it, don't we?
We really do, don't we?
We were just talking about, not to distract from what you were just saying, but we were just talking about how all hygienists have like the short nails.
Short nails.
It's like short, not polished. You know, if I feel like it's past the fingertip, it's like I'm going to jail or something.
I know. And when you go to the nail salon, they're always like, why are they so short? And you're like, well, because
you're like, I don't want a boyfriend. That's what she said. She said, you sure you don't want longer? This is back when, I was dating and I'm like, no, I'm good. Or I would be speaking and it's like, okay, yeah, do them a little bit longer. I don't know. But we were that's right. Kind of the off cuff thing that Katie and I were talking about. So that's one of the things that you got along with going against your aunt to be like, yeah, no, I get short nails for the rest of my life and I get mouths.
Yes. And it was the best decision ever.
Isn't it the best profession?
It really is the best profession. I tell everybody. I will tell you, I ran into a hygienist when I was a dental assistant, and she was like, oh, what do you want to do? I was like 17, 18. And I was like, oh, you actually want to be a hygienist? And she was like, I wouldn't. And I was like, oh my gosh, I'm never going to be you. Anybody who ever tells me they want to be a dental hygienist, I am going to tell you it is amazing. It is awesome because it is. I mean, all jobs have their pros and cons, right? Mm-hmm. But I think the pros in hygiene are so much better than the cons. And I would choose it over and over again.
Yeah, there's so much opportunity, I think, for ourselves. And so you mentioned that you were a dental assistant?
Yes,
Okay,
I
so you
was.
graduated. Were you a dental assistant before you went to hygiene school? Tell us.
Yeah. Oh, let me tell you my origin story because it's kind of fun. I was working in a party store when I was like 15 years old, blowing up balloons, and there was a girl that was working there with me, and she had quit and left, and she went to be a dental lab runner. And
Ooh.
so then, yeah, and I was like, oh, that's neat. So she would take crowns and bridges and dentures office to office from the lab back and forth and stuff. And so she was actually, after we graduated high school, she was going away for college. And so that job opened up, and I was like, I would love that job. So I started doing that. And when I was actually at an office delivering a case, a dental assistant ran up to me and was like, hey, would you like a job? Would you like to be a dental assistant? And I was like, actually, I would. So I pivoted into that, and they just trained me off the street on how to do dental assisting. And I just honed in on everything. I remember the first time I saw a tori, and I thought it was a tumor.
Yeah. Oh,
were
yeah.
you ever a dental assistant?
Oh, yeah. Oh,
Yeah,
yeah.
see,
I was a
my
certified dental
dentist made
assistant.
me feel so dumb too. I think at this time I was like 19, maybe 18, and I was like, oh, Doc, what is that? She was like, it's a tori. And I was like, well, what's a tori? I had
Yeah.
no clue. And I really thought that the patient had some kind of tumor down in their mandibular
Well,
region
unless
there.
you know, how do you know?
Right? If you know, right?
Right. I mean, you take classes for it in hygiene school and maybe assisting school, but it's funny the things that end up being such just kind of everyday things that we are just normal to us, but someone else is going, wait, what? Wait, what? Because even our
Yeah.
patients are probably like that sometimes.
Yes, of course. They're probably freaking out that they have a tumor growing in the bottom of their mouth.
So then after you were an assistant, you went to hygiene school after that.
Yes, I did. So I went straight from dental assisting into hygiene school, and I graduated hygiene school right after my 21st birthday.
Oh, wow. Yay. And do
Yeah,
you feel like being a dental assistant before helped you in your journey as a hygienist or hygiene school?
I do. Do you feel that way?
Hmm. Yeah.
Yeah, I feel it really made a difference. At least with polishing and just feeling comfortable in the mouth, and just a lot of the things that we already do as dental assistants that kind of trickle into hygiene, the comfortability of it all. So
Yeah, I think just being in the environment of it and knowing the way, in large, how things flow in an office, how a patient comes in, how they check in. And if I didn't know all of that, I wouldn't have been able to put some of the concepts together. Or I think that it may have been a larger learning curve, I guess I should say.
absolutely.
So, all right. So you were a hygienist. You are a hygienist. How long did you
Yes, I
practice? And then tell us about your transition.
Okay, so I got out of school. I practiced in my first office for about 7 years, and that was a really perio-driven practice. Just a lot
Hmm.
of perio education and perio diagnosis, and really focusing on the guidelines, the AAP guidelines and stuff, and how to diagnose perio. So I really did hone in on my perio skills there. But at that point, after that 7 years, I kind of figured that the position I was in wasn't leading me anywhere further than just clinical hygiene. They had the ability to have a periodontist come in, and I could, when they flapped the tissue, I could use a Cavitron around those surfaces and stuff, and that was fun. But that it kind of died down fast, and I wanted to continue on with more than just the day-to-day clinical hygiene. I wanted something more advanced. So I had remembered in hygiene school, I did a rotation at a perio office here in Las Vegas, and they had the perioscope there. And I remembered that I had always wanted to learn that. And so the only way to be able to learn how to use a dental endoscope is if you have an office that purchases it, or if you purchase it on your own. And so I was like, I need to figure out if I can get a doctor to purchase it. So I left that one office and transitioned to another office. And when I was hired there, the intention was that they were going to buy an endoscope. And so I started that position. Endoscope wasn't there. I just kept pushing Doc, hey, Doc, this is what was promised. Let's get that endoscope. And so after about 4 months, he caved and he did purchase the endoscope. So
Cool.
I started learning the endoscope there.
So then you learned it, and then was it pretty easy to fold in, to integrate into what you were already doing day to day?
Yeah. So there were a couple of things with the endoscope in this particular practice that we were using it for. So not only the perio entity, we were also using it for cement removal post-cementation. This doctor was an accredited or is an accredited dentist with the American Academy of Cosmetic Dentistry. And so when they go under their case presentations, they have to have pristine gingiva. And so doctor wanted to utilize it that way to remove all of the cement post-procedure. And the results that we got with the gums were phenomenal. So his motive was that. My motive was perio. So I was able to learn, though, I think the ins and outs of the endoscope a little bit quicker because we were using it so frequently for cement removal that it helped me build on to using it for perio, because obviously now we're going in deeper pockets and we're dealing with a lot more debris compared to just marginal cement. So.
And then you were thinking, man, I could have really used this in my perio practice.
I'm telling you, my whole entire career. It's kind of like, are you familiar with the relief suction?
Yes.
Yeah. So we got those for COVID, and I would sit after we got them and think, why didn't I have this my entire career?
It's always like
career.
that.
Yeah.
It's like, it's always like that hindsight. And it's like, someone developed this, so why couldn't I think of that?
That's one thing that you're thinking too, right? You're like, oh, this would have been so easy to think of. But then the other aspect of it is like, why have we been like going like this the whole time when I could actually have better ergonomics with this suction here? That's basically a chairside assistant.
It is.
Yeah.
So
same with the scope.
Yeah. So you feel like it integrated pretty well, especially since you guys were using it so much for other applications. And then at what point did it, well, I have a lot of questions. Did it become part of every procedure from a hygiene standpoint, even healthy patients, or was it 5 millimeters and beyond? Or when did you say, okay, this is the kind of patient that I'm going to use this for?
Yeah. So in our practice, after we had it for so long, we were like, the uses of this technology are endless, and we should allow the patient to determine if they want the treatment or not. So we would put it in the all of the SRP cases. Anybody who was diagnosed with SRPs would have the option to choose to have it done endoscopically or not. And then at some point, I wanted to experiment with it and use it on scaling with gingivitis, because sometimes those patients have heavy calculus. They don't have the bone loss, but they have heavy tenacious calculus that's been down there for a long period of time. And we find with the endoscope that we can remove that tenacious calculus without a problem, ensuring that this patient got full calc removal so that they can get actual gingival healing without any question. Then we don't necessarily have to move into the SRPs because we got it the first time with the endoscope. So,
yeah. So I have a technical question. After you found those sneaky areas, and it may be site specific, that the answer to this, and you thought that you removed the calculus, right? And you go with the endoscope and you're like, dang it, it's still there. Dang it, it's still there. Dang it. Is there an instrument that is always your go-to to say, I know that I can always get that, or most of the time use that to get that area?
So which area are you asking me? If there was an area where I had trouble accessing and I have a tool that can get it. So the left and rights. The left and rights are gold for endoscopy. When we learn how to use an endoscope, we learn that we are not properly adapting a lot of these tips in the specific sites that they belong, that we thought we were, because we couldn't see. So I didn't use my left and rights a ton.
You learn them in hygiene school, right? You learn them in hygiene school.
You learn them.
You learned them.
Yeah, right. You learn them because it's like, did we ever really truly understand what we were doing with that thing? Half the time you're like, am I using it the right way, with the right one and the right, the left and rights were confusing in
They
hygiene.
were. If it looks right, it's wrong.
That's a good one.
The left is right, the right is left.
Exactly. And then with the endoscope, you learn that too. Like you can use the left the wrong way or the right way or whatever it is. And it works because at the end of the day, it's getting that calculus off however that's possible. And we learn with the left and rights when we can see that they're a very valuable tip.
So even, ladies and gentlemen, this is a public service announcement. Even without the endoscope, the Perio endoscope, use your right and your left. If you need a refresher, ask me. We'll do a webinar on it. We'll do something about it. But it's what they teach you of, okay, especially if it's heavy tenacious calculus, more difficult to access areas, bifurcations, all the indications to do a right and a left. And I can tell you in the hygiene school I was teaching at, those tips always looked beautiful. Why? Because they were never used, except for skill competencies. There were a few students who were like, I can't live without these. So I digress. But
those students, they are left-brained or something. The left-brain thinkers, whatever they say about that, right?
It's them learning to at a certain level, right? To become to emerge out into the clinical world. So that's where all of us we start in that way. And then you go to integrate this type of technology. And then I think it starts to make sense. It's like, oh, that's why I need that. Oh, that's why I learned that. Oh, okay. I think I remember something like that.
Yeah.
Always.
Absolutely.
So with this device, tell me about, because I know that the technology has been out forever. Tell me more about how it's changed in the 20 plus years since it was born.
Okay. So, the initial one that came out about 20 years ago was perioscopy. And this is the technology that most people are familiar with. It's a circle view, and it kind of looks like you're looking down a tunnel. And even clinicians have trouble deciphering what they're viewing if they're not trained, right? So here I'm trained and I'm like, oh, look, like thinking it's obvious. And I have clinicians all the time. They're like, I don't know what I'm looking at. And so then, oh, of course. And so then I'll explain on the screen. And so then there were some other scopes that came out. AuraView is one, but it didn't really make it. There really wasn't much interest and it didn't get picked up. But then now we have PerioView, and PerioView, the clarity of this technology is night and day from perioscopy, where I will show clinicians a video and they already can see what they're looking at. They can tell that we're seeing tooth structure versus calculus. You can see root fractures. Everything is just so much more clear. It's like a 4K television versus a 90s television, so we wouldn't be using or having 90s televisions in our houses anymore. Same concept there. Like we're all with that 4K Ultra HD television in our living room. And that's what we've got here with PerioView. Like we just need to move on because this technology is just so spectacular.
Yeah, I haven't seen it in a while, so I'm excited. I would love to see the device in person and to put it in my own hands. How has there been a handpiece change? Has there been functionality change in it over the years as well?
A lot of the functionality stuff is the same. So the differences are very minor there. The only big difference is that PerioView has a full screen medical grade computer screen, and it can record the procedure and take still images, whereas perioscopy couldn't do any of that. So for patient education, it's huge. I would have to previously have a dental assistant run in the op and record the screen, and then I could share it with the patient. And it was, cloudy and pixelated, and, but they still understood it enough to see what was in there. But with PerioView, I just hit record, and then after I shared their procedure with them, and the patients are so validated after seeing their own video, and they just can't believe what they're seeing, and they say, I can't believe that was in my mouth, and they're disgusted, and there's all the feels. But it's fun. That's my favorite part, really, is sharing their videos after.
And then there's no need to do a post-operative x-ray radiograph to see if you remove the calculus.
Right, exactly. I mean, we still do, just because we like that the radiographs now don't have any radiographic calc. So we love to take the after photos still. But you're right, there's not a need. We're not using it as for a diagnostic purpose to see if we remove the calc or not.
Right. Because I know that even, in some instances, a lot of offices will do it for insurance purposes. But now I'm sure that you can even use the imagery from the device to submit to the insurance and say, here's calculus, here's what you're looking at, and describe it with a narrative.
Yes.
Like a big red flag. Me, there it is.
Exactly.
So you went from clinician to business owner, and then you all are going around to offices who schedule appointments with you to utilize the device almost as like a specialty service, if that's my explanation of it right now. But then also too, Katie, I think it's cool that you're able to scale this, and that no pun intended, but you're able to scale this business idea and take it to other states and say, other hygienists can do exactly what you're doing. How cool is that? Does that excite you?
Super cool. Yes, it excites me. It does, because I know too, our pioneers in this technology, the clinicians that were using it early on, they only dreamt of this, and the fact that it is actually coming to fruition definitely would make them all very proud.
That's awesome. So you are also training the good folks who are using this as well, and putting training programs in place. If they get a device, you're showing them, oh, okay, it's more so like this and less of this, right?
Yes, correct. So I'm just going to go back just a little bit to how I transitioned out of the op. I would do this procedure probably 2 to 3 times a week in my general practice at towards the end, before I left clinical hygiene. And I would sit in my op every time I would perform this procedure, and I would think to myself, this is all I want to do. Also, I don't understand why it's only here in my practice. We need to figure out how we can get this out to the masses so that everybody can have access to this type of care, or even be able to treat patients with this type of care. So then I, through a colleague, I met Marvelyn Navarro, who is my partner, and her and I developed Perio Precise. And what that does entail is clinical services locally here in Las Vegas, where we are licensed hygienist, as well as educating the masses, whoever will listen to us and wants to jump on the bandwagon of this technology, training, of course, as you mentioned, Kelly, and then coaching hygiene departments to be successful with their endoscopy programs.
So it started with you trying to solve a problem for the profession. You're like, why can't more people use this? Why is this not available to more people? And so you came up with a way to make that happen. What happened in that time from your initial thought to it actually happening? Like what transpired from that? Did you make a contact with someone? Did someone reach out to you? Like, how did the universe bring this to you?
And it's crazy because things happen for a reason, right? So the backstory is my office was looking for a hygienist, and there was a hygienist that worked at our office who works still currently for Dentsply Sirona. She's a rep. I had wanted to meet her for a while. They always talked about how amazing she was. So I went and had coffee with her. And I told her that in the office we were doing the endoscope, and she had no clue, even though she had worked there before. She goes, "Oh, I didn't know." And she goes, Marvelyn Navarro is doing endoscopy in her office as well. And I didn't know Marvelyn. And so I was like, I have to meet this Marvelyn. And so I just messaged her on Instagram, asked her for coffee. And Marvelyn I met for coffee, and Marvelyn and I were on the same level of passion. I had never met anybody like that before who cared so much about endoscopy and wanted the masses to know about it and learn about it. And just that power that we had when we bounced ideas off each other. We went from 0 to 60 in literally a week, had our LLC by the end of the week, and we didn't even know each other. Our husbands thought we were crazy.
They were probably like, wait, let me get this straight. She snuck in your DMs and she wants to start a business with you, and you guys are going to save the world.
Yes. And we said that. And our husbands, and they still do. We're about a year in, and our husbands, I mean, we definitely have validated everything, but they still, every once in a while, we catch them like, oh, okay, yeah, like giving us like sarcasm. And we're like, have we not proven ourselves to you? It just is funny. It's funny because Marvel and I just make such a fantastic team. And it couldn't have worked out any better. And I think that it stems from the passion that both of us have for, one, this profession, but also two, this technology.
Yeah. And you were trying to solve a problem with it, and you wanted it. Your heart was that you wanted more people and more patients to be able to experience the difference.
Mm-hmm.
So
yes.
You guys, this is all possible. It starts with an idea and knowing that you can get out of your way enough to make it a reality, right?
Absolutely. Yes.
It's but it's scary to go from one. It's scary and excitement can sort of feel like the same thing, of like that anxiety of, I don't know if I can, but then once you take like one little step towards it, it's much easier to see, okay, I think this is the right direction. Is that how it worked out for you all?
Yeah, definitely. I understand that feeling you're describing. And it's not like an anxious scared. It's like an anxious more so like, when is it going to happen on a big grand scale? Like, because that's what we want. How do we scale it tomorrow? So I think that's where more of the anxiety comes from. We've kind of already blocked out any possibility of failure because we're Marvelyn and Katie, and that's just not a possibility in our brains.
Love that.
So I think that's one thing too. Like, you just really have to, if you want to do something of this sort, like, you really just have to go all in with positivity and just tell yourself you're not going to fail, because there's a need for all these different avenues in our field. There is. I mean, look at you, Kelly. Your podcast's amazing. And, all the stuff that you're doing in the profession too is just, it's incredible. I should have thought of that. I would love to sit and chat with people.
Well, you still can. I'll help you do it. I tell people to do it all the time. Yeah, this is how the magic happens, you guys. It's that collaboration and that connection that you realize that synergy is there, because I'm the same way with you. I am the same as you in that I do not believe in coincidence. Everything happens for us, not to us. And so when that happens, you're in step what is made for you. And as long as you're following your passion, which is in your gifting, you're going to line up with where you're supposed to be. And failure, I don't even think exists. We name it that, but failure itself is just learning. You learn how to do it better, this or better.
Yes. You gave me goosebumps, Kelly. You did. Like, it's so true. I feel the same exact way as you. You just put it all into words.
Yeah, thank you for all that you're doing to bring this technology and these capabilities to us, because it's without people pioneering this and solving the problems with everything, right? Not just this, but in every way that we solve problems, people coming up with new instruments, new techniques, bringing it to light for others to know about, to say, my patients would really enjoy that. And the clinical outcomes I could I could be more effective with that, whatever that is for you. It starts with an idea, and it starts with that want to do it.
Absolutely.
So I appreciate our time together. Is there any final words that you want to say to the audience?
I just want to empower the audience to just follow their dreams. If it's, as simple as staying in the clinic, just, follow your dream in the clinic and find something that excites you and you're passionate about on that scale. If it's on a grand scale, just follow that path and make sure that you're doing what you love. And if you don't love it, don't do it.
Amen. Preach. Yes, exactly. Well, Katie, thank you so much. You guys, if you want more of Katie to learn about what she's doing, want to drop in her DMs to pick her brain.
Slide into my DMs.
Slide in. You can see her information in the show notes below. The show notes are all the details that go along with each show. And yeah, so Katie, thank you.
Thank you, Kelly.
Thank you so much. Yes, it's always such a pleasure, and to see the people who are making a difference in the world in different ways. So to my listeners, love you, love you, love you. And you guys know what I always ask is to go on to Apple Podcasts to give a 5-star rating, because Apple is the one that matters. Go on over to YouTube, like, subscribe, share to all the friends who you love. And thank you for all that you do every day to touch people's lives. We'll see you soon, my friends. Thank you.